Welcome to the Predictive World series brought to you by SalesChoice, a company that specializes in ending revenue uncertainty for human advantage. I'm Jen Yim. I'm the Director of Product and Marketing here at SalesChoice, and we bring three offerings to the market. The first is Sales Insights, which helps sales professionals meet their goals and with guided insights. Mood Insights, which helps frontline employees' voices be heard, all powered by AI. And our third offering is AI and Data Science as a Service, designing and building and maintaining AI models with a new line of business on generative AI. Over the years, we've been hosting numerous experts, thought leaders in many fields related to AI and revenue growth. And we've built a trove of podcasts, webinars, and white papers and more. You can find that all at saleschoice.com/resources. Today, I have with us Candice Paik, Aaron Holloway, and Dr. Luigi Vacca of Tallywell. Welcome and pleasure to meet you all. Could you tell us a bit about yourself, starting with Candice?
Yes, of course. And first and foremost, thank you for having us. We're really excited to be having this conversation with you. I'll just keep it short and simple. I am the CEO and one of the co-founders at Tallywell. I feel very lucky to be on board a little close to 6 months now. And previously, I've been in the corporate world, also dabbled in startup as well.
Nice. And I'll turn it to Aaron.
Sure. Long-time technology entrepreneur focused on building products that are data-driven and digital and engaging consumers.
And Dr. Luigi Vacca.
Thank you for having us. My name is Luigi Vacca. I have a PhD from MIT on high temperature physics, plus another doctorate from the University of Rome. Previously, I was in the banking business, creating financial models for banks, insurance companies. And right now, I head the machine learning effort at Tallywell. Thank you.
Amazing, from health to wealth, really. And I'd like to turn it to Candice to tell just a little bit about Tallywell.
Great. We'll go into further detail, but just very high level, Tallywell is an AI modeled Apple Watch app. And what we do is we measure really complex data that's already found on the Apple Health Kit. And we make it easy to understand with a 3-digit score of health. So ultimately, keep in mind that prior to Tallywell, many people had to rely on just analog health metrics and didn't really have an easy to understand score. And we provide that for our users and for employers as well.
That sounds amazing. That's something I definitely already want because I've seen all these charts and all these spreadsheets with my own data, and I don't even know how to interpret it. So this sounds amazing. I'm going to turn it over to our own Dr. Cindy Gordon to steer the conversation.
Thanks, Jennifer, and welcome everyone. We're delighted to have you on our series. And obviously, the journey and the importance of health and wellness is really a critical success factor to make our world, I think, a much happier place. I know, building out a company in this space is a challenge. So I would just love to start with your vision of Tallywell. You obviously saw gaps in the market, Candice and team, and maybe we can start there. That would be, I think, a good first conversation.
Yeah, that sounds great. I just do have to interject first and foremost, we're really recognizing that health is multifaceted, right? And relying solely on one aspect of health doesn't provide a complete picture. And so with that acknowledgement alongside the ongoing and ever advancing realm of data, health goals get overwhelming, and quite frankly, it can be confusing. And so Tallywell is an AI modeled health app based on the consumer credit scoring system. And our mission, our vision is clear, right? We're committed to really simplifying complex data to measure health risk, which ultimately we're hoping influences preventative health behavior for that healthier lifestyle. And so we've taken data that already exists, as mentioned, on the Apple Health Kit, and we're translating it into this easily understandable health risk score. And from that, similar to the credit report, you also receive a weekly Know Your Numbers report, which breaks down how you've been tracking for the week and ultimately to increase your quote unquote health score. So with that in mind, we have to keep in mind all of the spotlight on wellness and health. It is remarkable, but it really hones in on the fact that health literacy is really crucial. There was a recent study from the Milken Institute that revealed that 88% of US adults have inadequate health literacy, rendering them unable to navigate not only the healthcare system, but promote their overall well-being effectively. So with tallywell, you're able to do both, and we're hoping to educate users on what it means to be healthy and take preventative measures.
Thanks, Candice. Just setting that stage, and maybe we could just bring in Aaron's voice in the sense of just adding to the business problems that you're solving. Is there some specific business problems that are more, I'd call it extenuated, that you've actually proven out a little bit more? Because obviously there's so many parameters, but if you could just expand on where you're at, Aaron, and where you maybe hope to go.
Sure, I think it's twofold. One, we're solving for the fact that there's not a universally understood health risk score. And so that's a little obtuse when you look at it in the vein that there's one that's easily understood to be a consumer and engage lenders and banking institution as well. So, we have to make health paramount to wealth, to tread on the conversation or the comment made earlier. So that's one big aspect of what we're solving for. And the other is the ever-rising healthcare costs that impact individuals as well as employers, right? And so we talk a lot about it, but there's not a lot of action and there's not a lot of product. And that's primarily why we chose and set out to solve for this white space. We feel that we have a very comprehensive platform to help both individuals and employers.
So at this point in time, Aaron, where, it's all, if you have a voice in the sense of concentrating, is it the consumer side because you want to get, the eyeballs out there and the data, or are you mainly wanting to hit the B2B market where they supply, the right, the right capabilities to have the score? Any thoughts on that? Because there's only so much one can do in building a business, right? You can't necessarily press on both levers at the same time to get the pervasiveness in the market.
Well, I will disagree with you a little bit, right? If you look at who we are, you can think of us more akin to credit scoring platforms, right? And so they straddle both sides of the fence, right? They legally, by law, have to give you your credit report at least free once a year, right? So that's a free product to the consumer, right? But then they tie that consumer to the institution, the lending institution, right, by engaging them with your data, should you so opt in that data, right? And so ultimately, they make their money off of straddling both sides of this very complicated problem. How do I put a consumer in front of a lender and take out and demystify all the risk, right? That's what the lender wants to know. How risky are you? And so when you go to your doctor, hopefully once a year, a lot of us don't, right? How are you going to build that health score, right? So we're that intermediary that allows individuals for free to obtain their health risk score, right? Which is easily understood, predicated on the credit rating system. I think it cuts in and across socioeconomic divides. Everyone understands what a 500 credit score means and an 800 credit score means. And so we need to provide that for consumers, and we do that for free. And we do that because people are employees, and employers are the number one provider of health insurance in the United States of America. And so as a result, we're going to get to our ultimate client, which is an employer who insures populations of people with health insurance. And we help them demystify that by analyzing claims data that better allow us to target at-risk populations, drive intervention, prevention, and hopefully not just save lives, but save both the individual and company's money.
Thanks, and I really appreciate that additional context. That so strategically, you're working both sides of the equation all at once. Maybe we can expand. I think we will go to question 4. And Candice, are there any customer stories that you can share at this point? Obviously, that you're comfortable in sharing.
Right, of course. As it pertains to the specific customer base, we can hold off on that for the time being, because I really do want to focus on the fact that we did launch in October. It has been in inception for close to 2 years now, and I'm sure Luigi, Dr. Vacca will go into it in further detail. But we really honed in and focused on specific communities and groups, and one being working and partnering with police departments. And so we have 2 programs right now, pilot programs we've initiated with both Boston University PD as well as Beverly Hills Police Department. And so far, the feedback has been very positive. As it pertains to just general organic users, the number one feedback that we're hearing is about the simplicity, right? So it hones back into our mission and our vision. They're surprised to know that not only is it easy to download, easy to use, they don't have to input any additional data to track their health, as it exists already on the health kit. And so being able to hear that feedback is remarkable, because ultimately that's our goal. Anyone that's using the Apple Watch, which I believe is close to 15% of Americans in the US, it's great to hear that it's simple to use, it's easy, and it's a great feedback tool.
So I just put my mic on quiet so there's no background noise. But thanks, Candice. Interesting with the police department. Obviously, there's a lot of value in going into a highly critical group, right? Where, they're going to really scrutinize and validate the value was one of the early use cases. I think that's very, very wise. Didn't know that the penetration was so high.
I actually will just correct that just so we do get that right. It's actually 1 in 3 Americans that own an Apple Watch.
Okay, so huge segment of the market. Thanks, Aaron. Any other customer stories you'd like to highlight at all? Otherwise, let's go to the AI conversation and bring Luigi's voice in. Okay, so Luigi, I could see in the design of the actual app, and I've only seen your visualization side. A lot of thought went into the design and the user interface to get the simplicity. And so obviously there's a rich back end, but whatever you're comfortable sharing on the methods that you're using, as it relates to AI, I don't know if you're, using predictive analytics as your methodology, or if you're, if you've built things into a neural net, maybe not yet, given where you're at, but just curious on the methods and the approaches and any early observations.
Thank you. First and foremost, we are using machine learning, not AI, just to be sure. And in particularly, we're using the predictive analytics. So predictive analytics is projecting values and behaviors into the future. That's the goal of predictive analytics. As already Aaron and Candice have mentioned, our scores are following the lines of credit scores. So there are scores that reflect a certain behavior, if you like, of the user. And they also imply a certain projection into the future. We collect this data and we make predictions what the scores could be in the future by regressing the values of our data sets. That's in a nutshell what we do.
So essentially, just to be open and transparent, we have data already in the Apple Watch, and you're able to access that data with an API that's being able to then add another visualization. So how does that work on all the permissioning and security? Just curious.
I figure they signed a release as far as the data privacy issue is concerned, but Aaron perhaps could say more about that.
Yeah, Aaron, we can't hear you. I think you're on your mute, son.
Sure, sorry about that. So no, Luigi's right. We built our product on the Apple platform for one reason. We feel we're best in class, and we aligned ourselves with best in class technology. and I would say the most secure and open platform that protects privacy without fail, right? That's been proven in the public domain time and time again, especially when it comes to law enforcement. So they give us a permission to access your data if you allow them on their platform to give us health kit data, right? And so that right there is a decoupling factor that really protects the user. If you come to our platform, Apple actually intervenes in giving that data first through their platform and the authorization of that data before we even get it. And once you get it, then you are in a trusted environment. We take tons of technologies and methodologies to ensure that data is encrypted both in motion and at rest. And so that's, just kind of best practice. We are not a covered entity. So by law, we do not have to abide by HIPAA, but we actually follow HIPAA guidelines when it pertains to data at rest, logical physical access, et cetera. We take this very seriously.
Yeah, so that's helpful. So essentially, the user's given permission for Apple, and there's an API where Apple allows you to extrapolate and create some new innovation value. Yeah, it's going to be interesting to see how the market evolves, right? They're all at kind of different stages, and on the is the consent really understood at the Apple level, right? But we don't have any laws that are into that yet, right? But I think over time we're going to have to be very, very thoughtful on how the market evolves. But I do understand how you're approaching the problem, and Apple is a good brand to be behind. At least having them out front is always wise, right? Are you going into any other ecosystems, or is it mainly the Apple stack right now that you're focused on?
Primarily the Apple, and it goes back to your surprise in market penetration and Candice's giving that fact that there's a significant group of people that are most likely when in our sweet spot employed, right, that are receiving healthcare benefits from an employer, and so that's something where, from a reliability perspective, the device quality is probably the foremost approved wearable when it comes to clinicians or healthcare providers giving thumbs up on that data. And so we feel that it was just the best situation for us. Data is data. We could get it. We could source it from competitors such as Fitbit, Garmin, et cetera. But I mean, those brands just don't have the trust that Apple does. And we want to tread on that trust. We want you to trust us. We allowed ourselves with the best in class solution. If employers or other people need an Apple Watch, we are working diligently to make sure that we can provide Apple Watches at an amortized cost to the masses, right? And so though that is a solution that we're focused on heavily, but at the present time, we have no desire to go off of Apple, right? So hopefully that answers your question.
Yeah, for sure. Do you see a risk at all with Apple learning from what you're doing and then augmenting a visualization layer that does what you're doing? Because yeah.
I'd love to think that we have the drop on Apple, but I think from a resource and intellectual perspective, they can do whatever they want. They're probably the most sophisticated entity to exist in our culture of humanity, right? And so I think what they do realize, being as smart as they are, is that they have a very large, broad mission that's damn near impossible that they've cracked, and that they'll let other developers come into their ecosystem and add additional value to the masses based on their unique innovation, if that makes sense.
Yeah, it does. Maybe one of the things to think about is going after Apple as an account. I'm sure that's been on your thought process, right? Because
well, if they're listening, we definitely would love to be acquired by Apple, sure.
Yeah, no, I didn't mean quite the acquisition. I meant just further market validation, because probably all of their employees are wearing the Apple Watch, right?
I think really, to be honest with you, they're probably so large and so efficient at that, they don't need us. But the real sweet spot for us are those employers that employ somewhere between 250 to 500 FTE that don't have the resources that Apple do. They're focused on creating widgets, right? So delving into their claims analytics as a secondary thought to becoming profitable. So we want to get to that sweet spot, if that makes sense. The behemoths, they'll find ways to save at the bottom line. But those mid-market people, they could really use our help, I think.
That's great. Thanks so much, Aaron. I really appreciate it. Luigi, let's turn it back to you, but let's talk about lessons learned in machine learning. And I do understand this distinction. Yeah, so
it's a huge question. Thank you for asking that question. Obviously, I'm going to focus on the field of healthcare in this case, or in the wellness space. We are in the wellness space. We're not a medical device. We're not regulated by the FDA. So the type of analytics and the way we create our models will be slightly different, are slightly different when we compare it to models that are used to healthcare situations. So one important lesson is that AI is a science as much as an art. Another lesson is that we like to create models that are compatible with the huge body of work that exists on healthcare and on the wellness space, specifically on CDC reports and CDC recommendations, on medical papers. So being able to merge these two fields, the answers that are provided by AI and this huge body of research, it's really the most important thing to us, or one of the most important things to us when we work with AI, doing what we do.
I'd be remiss, Luigi, if I didn't ask another question. So obviously you've got access to a lot of data, right? Just based on what we've discussed, because you're tapping into a huge data set. What about is the data that's coming in structured in a way for you that it's, easily usable? Or are you having to evolve and, meta tag in some different way? I'm just, sometimes things that come in aren't necessarily structured the right way, or
No, not in our case. We collect 4 major attributes: the number of hours that people sleep at night, heart rate at rest, how much people walk during the day, and BMI. So we get directly these values from the health kit, from the app, and so these values are really ready to go, so to speak. And then obviously they get pipelined into the models. So we don't have an issue of, let's say, formatting the data or changing it to correspond to our specifications. There's no issue on that place.
So are you then bringing in other third-party data sets is that kind of the vision?
Yeah, we also collect synthetic data on which we check our models. Yes.
Yeah, it'd be interesting, just based on the discussion, is could you take the credit score, and look at that in relationship, right? So it's all kinds of other things, but the nice thing is that you've got a very secure channel. With the data science side, there's only goodness that can come to augment. But I know Jen's inspired, and we're going to have to take a closer look at the user experience. But just really want to say thank you for the time. It's hard not to spend more time on these conversations, but bringing a product to market that's in a significant channel. It's a trusted channel, Aaron, that you mentioned and reaffirmed, which I think is important. And focus is critical, in terms of go to market. And, Luigi, with your pedigree and background in technology acumen, the soundness in the approaches and methods, it's good to hear, because, I was interviewing another CEO of another company earlier today, and the importance of a role like you have, Luigi, is key. And Candice, you've got so much energy, like, to really to have that passion and bring it into the market, that's so key, and also generational perspectives as well. So just thank you so much. I'll pass it back to my partner, Jennifer, who'll close things out, but thank you for joining us today.
Thanks, Cindy. And thanks again to Candice, Aaron, and Luigi. It's a pleasure to connect and chat on this together. And thanks to our listeners for joining us for the Predictive World series by SalesChoice. I'd just like to invite our listeners again to go to saleschoice.com/resources, where we have a mountain of AI and thought leadership content across many years. And join us next time for more insights on the AI world.